So my name is Tara Marino, and I'm the Executive Director of the Serenity House of Flint. And what we do is we advocate and we educate on the current public health crisis of addiction, as well as advocating and educating on the use of holistic medicine and the current recovery model. And we hope to become transitional housing here in the future, meaning that we will offer a program where participants would live with us while they heal from addiction. I founded the Serenity House last year of March, and I'm a person who has been in long-term recovery for over 7 years now. And when I was in my early recovery, I was using a 12-step program with a therapist and a psychiatrist to help me with emotional issues that I was having. When I was in recovery at about year 5, I stumbled across holistic medicine. And when I did, it had taken my recovery to an entirely new level. And my wellness just skyrocketed after that. You know, I was on a ton of medication and it did nothing but hurt me even more. So when I found natural ways to heal from it, it was just so amazing that I knew I had to organize and get it out in a nonprofit way. The first annual Flint Recovery Walk and Rally was on last year, September 26th, at New Paths West, their transitional housing out there. We had speakers. We had Congressman Dan Kildee there speaking on addiction in our county and how it affects the entire community. And he spread a lot of hope that day. The participants, they did a 5K walk and they walked downtown Flint with their signs and spreading awareness to eradicate the stigma surrounded around addiction. And then we had our Flint Recovery Music and Art Show, and that was an event where we had musicians and artists getting together and basically doing the same thing but through art and music, where they we spread awareness about addiction and what it is, bringing it out into the open and not trying to hide it anymore. We also had speakers too, so we had a couple recovery coaches speaking on some of the current advocacy that's happening in terms of addiction. Our next move is to get a permanent place to practice out of. So all of us that work for Serenity or volunteering for Serenity, we're doing it out of our homes right now. We're doing it scattered or trying to work with the providers. So having a stable building to work out of is imperative for our work, and that's our next step.